view. And last, how many of us think that breast cancer is a part of gynae malignancy spectrum? Okay, so gynae malignancy is basically, breast has not been traditionally part of gynae malignancies. So gynae malignancies are those malignancies which arise from a woman's reproductive tract. So we have uterus, we have ovaries, we have something called a cervix, which is the most preventable one. As you can see, the hype coming up in newspapers and social media these days. So cervix is basically the downward portion of the uterus, and we have something called as vagina and vulva, which are the parts of birth canals. So we did a study along with my colleague from Community and Family Medicine Department. So as I have seen that gynaecology services are largely unutilized in India for the entire world as a whole. But it's increasing in incidence because nowadays about 40% of all the cancers in women and gynae malignancies, and they're coming up in a greater manner because the cancer of the uterus is catching up in the developing countries as well as the developed countries. So in India, the scenario is a little bit different. Here, breast cancer is the most commonly occurring cancer in women, followed by cancer of cervix. So women are largely unfamiliar with this subspecialty because it's a relatively upcoming branch and there are not much discussion happening around the table about these cancers. So optimal cancer requiring screening, we have screening for cervical cancer. They require insight into the healthcare preferences of women. As ma'am who has spoken before me said, the healthcare preferences and the behavior are not talked about much in our community. So especially in relation to the healthcare providers, they have a specific and fixed opinion. So we wanted to look into the factors why, in spite of being promoted out and about, why the women are not coming forward to take advantage of these services. So objectives of the study was, primarily we wanted to explore women's healthcare services, their preferences for this type of cancers in the India's northeast region. Why we focus northeast region? Because this is a region which is having inherently risk factors for this type of malignancies. Like there are various socio-economic and cultural factors which are considered as risk factors for this type of malignancies. Secondarily, we wanted to identify facilitators and barriers which affect a woman's healthcare choices in coming for help seeking in this type of malignancies. Okay, so this is my methodology. We have focused on the qualitative study design, and we have taken semi-structured, in-depth face-to-face interviews. Our target population we collected with purposive sampling pro forma, and we took female patients and their attendants who had attended the OPD for any queries or any complaints, mostly gynecological or obstetrical. So we had conducted these interviews in Hindi and Assamese basically.